And all right. My name is Judd Mellinger Blouck, and I'd like to welcome the viewer to another in our series of interviews with Community Health Center clinicians. And today we're with Dr. Aqiyla Mohammed. She's the Chief Medical Officer at Spectrum Health Services in West Philly. Dr. Mohammed is a Philly native, born and raised. Did her undergraduate work at University of Pennsylvania in West Philly. And then ventured out to bucolic Hershey, Pennsylvania, and did her college of medicine, did her medical studies at Penn State, and then went back to the city, went back to Penn for her residency. Dr. Mohammed, welcome.
Thank you so much, Jed, for the precise succinct summary of my background. Thank you.
You're welcome. You're welcome. So tell us a little bit more about your background. You know, you grew up in Philly. Where in Philly? You know, kind of any of the family influences you had in your career. You know, anything you feel comfortable sharing about. You know, what led you to this career?
Right. So I was born in West Philadelphia. My mother told me I was born at Penn. I'm not sure if it was Penn or Pennsylvania, but in West Philly. I actually grew up in a community center during the time in the, I guess, I'm an 80s, baby, born in the 70s, but grew up in the 80s. The Islamic influence was really, really heavy in West Philadelphia. And my mother, she actually moved from Washington, D.C. To Philadelphia, just that she converted from Christianity to Islam, and to really begin her family root in Philadelphia. They had a strong Islamic root here, and so the first 8 or 9 years of my life, I actually grew up a few blocks away from where Spectrum is, and as I recollect as a child, I'm almost convinced that I went to Spectrum. I did go to a community health center when I was younger. I didn't, really think about it until, someone asked me, like, oh, where did you go? Did your family go to an FQAC? I clearly remember 52nd Street, and I remember Spectrum, had Haddington was a previous name, and it had a previous name before that was on 56 and Vine. So I want to say that I started my, career as a child at Spectrum. That being said, my family moved to North Philadelphia once we moved from that community living to our own a single family home with the nucleus of the mother, the father, and the children. And so the remaining of my childhood was in North Philadelphia. I went to public schooling for the majority of my education. Aside from in middle school, I believe what's middle school?
6th, 7th, 8th, something like that. Yeah.
So 7th and 8th, I went to Sister Clara Muhammad, which is in West Philadelphia.
Okay.
And after that, I went to Girls High, Philadelphia High School for Girls, for high school, and graduated from there back in 1995. So during I'm very competitive. Girls High was a perfect match for me because it had the diversity, it had the curriculum. I was able to apply and complete advanced placement courses, particularly in the sciences. That was the sciences and the math were my strength. And for some reason, I had advanced placement Spanish. But if you ask me to conversation in Spanish, I probably won't be able to speak fluently. That being said, Girls High was the time where I was able to really appreciate and really get excited about opportunities that education could provide. I didn't have, so I'm the first in my family, my generation, to have gone and graduated from college. And so everything that I learned about higher education came from, the teachers and my guidance counselor, and just really being excited that there was a world, outside of North Philadelphia, West Philadelphia. And so that was the beginning glimpse of hope. My family, I'm one of 8 children. we lived very modestly.
Mhm.
We actually had a period of time where we you know had to live have other families help us and also we lived in the project community in Philadelphia, and so it was a struggle financially, but me looking back, I didn't really appreciate it because I had my parents love and attention and nurturing, and so that that was everlasting and more important, I guess, than not having the lavish things in life. And so so that strong foundation, my mother, she was an educator. Once she prioritized and she made it her life goal to stay at home and educate her children until we were of a certain age, and then she went to school. I must have been maybe in high school or maybe after high school, where she went back to complete her education. She's a teacher, and she opened up. She enjoyed teaching the preschool age. So she
Mhm.
actually opened up her own preschool at our current home in the basement. And so yeah, that was college because I don't remember that happening when I was in high school. And
Right.
so so my point is that she's an educator, and I felt that because she really nurtured us and really emphasized and really stressed the importance of just like education. She actually really preferred that I not um, obtain any side jobs. So I don't remember doing any McDonald's or whatever kids were
Sure,
doing to get
sure.
extra money. Even though we didn't have money, she emphasized that education is the best investment in your future. And so
Wow.
so with that being said, um, I think my first job was like a work study. You've heard of that? Work study in college.
Right,
You're really studying, but you get a couple of hours.
right.
So that really allowed me to really reflect on my calling in life. I've been told by teachers, even especially my mother, that I was gifted. I excelled in school. I was really passionate about school. I was really great in like science and math, and and um, so the piece of it as to what led me to medicine, as I reflect, I really feel that the impetus was just seeing not just my community, but my family, my relatives, just understanding the history of my family is that like almost like almost everyone passed away at an early age.
Yeah,
Be like in the between age 40 to 60. We seldom had anyone in our family that lived beyond 60. We currently right now have an aunt who's in her 70s, but everyone else, she's one of 12, and she's the only one remaining. The other siblings, they passed away in their 40s, their 50s, and 60s. So that was baffling to me. And so I felt that, and just hearing about, the causes of their death, a lot could have been preventable. A number were, heart disease. Obviously it could have been high blood pressure that was unmanaged, uncontrolled. And I just heard that a lot of the family members, they didn't go to the doctors.
mhm.
Why not? um, a lot of mistrust in the healthcare system.
Yep,
So,
yeah,
so, and that was reflective on, the community at large is how do we instill trust in the healthcare system? And so I figured I needed to enter it
right, 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 right.
and figure it out. So
That's
that
right.
was the main like impetus for me to like really understand the mistrust and really be that voice. If albeit only one, if I'm only one person, but if I can be that person for the patient that will allow them to gain trust in the system, then it could change, it could save lives.
Yeah, sure. So does that is that what led you to go into family medicine, or did you ever consider going into a specialty of any kind?
Yeah. Yes. So at Penn State, of course, they, take a lot of classes, do a lot of rotation. Initially, I considered um, pediatric psych. I was intrigued by, psychiatry
Right.
and just behavioral processes. I considered women's health, so I consider OBGYN because I, related to the women.
Of course.
uh, I also considered um, so I actually, funny story is I actually applied during my, I guess my last year um, of um, of medical school. I applied for what did I apply? Pediatric, because I was really particular in doing a subspecialty in adolescent medicine, and just like I really bonded with that age group, and just really focused on family planning, just overall adolescent health. And so I actually applied and just really thought about it, and I actually thought about it and felt that family medicine would be more appropriate, because I don't want to say like pigeonhole into one age group. I
Right.
wanted to be able to, you know, address that population, but also address the spectrum of patient through all phases of their lives and all disease processes. And just I did a rotation with a family physician, and I saw that yes, you're able to do the breath, but you can focus and like hone your skill in a particular
Mhm.
area. And so I felt comfortable with that. And I do not regret it, not one bit. Like I love
Right.
I do the flexibility.
Right. Right. So in medical school, were there any people saying, Aqiyla, why are you going into family medicine? Anybody trying to talk you out of it, or were people pretty supportive of it?
Um, I don't. It's not a. I don't recall it. I'm not sure if people have, but it's not something that was
Okay.
like lasting imprint for me. I knew that I wanted to go into like working. I knew I wanted to work for the community, and I
Great.
felt that having the breath, I could you know affect more lives. I could be more
Sure.
flexible. And more marketable. And no, I didn't have any. No. Mm-mm.
Okay. That's good to hear. So you've been practicing for about 15 years now. Don't mean to make you feel old or anything like that, but tell me a little bit about your career journey. I know you worked for an FQHC before Spectrum. Tell where'd you start out at when you came out of medical school? I mean, when you came out of your residency, and what's the journey been like that's led you to Spectrum today?
Right. Okay. So yeah. So I went to completed my residency at family medicine at the University of Pennsylvania, and they have different tracks. My focus was on community medicine, so I've had previous exposure with that. We've actually had, although I wasn't, but we've actually had other residents that rotated at Spectrum and other FQHCs, and um, so upon my search and interviewing process, I believe that I only applied for community health centers. I knew that I wanted it, so I applied to all the different, and not only in Philadelphia. I have family in Washington D.C., so I actually applied there as well. And I interviewed, with Quality, and it's in North Philadelphia. My current family lives in North Philadelphia, and I had a connection when I interviewed with a couple of the providers there, and I was I was interested. I was intrigued.
Mhm.
I would be able to work in the community where I live, and so I worked there for a little over 4 years, and there's been some transitional change with the leadership, that I felt that I needed to have a little bit more stability in my career, and so I still wanted to work at an FQHC, a health center. and so I applied to several health centers, a few FQHCs in the city, and I explored everything, the benefit package, the hours, the location, the structure, and decided on Spectrum. That being said, there's a provider who worked at Quality who moved on to Spectrum several months before, so I had close communication with that provider who convinced me to also move on to Spectrum. And
Yeah.
so I started there in October 2013, and as a family medicine physician, during that time that year, I started, I believe, a year after they moved from the to the new location, the new building, and they've also recently had changes with the administration. And even while I was there were a lot of changes with the administration. But I really the patient care, the community, that's the aspect of my job that keeps me committed
Right.
and I understand every job may have its own like bureaucracy, politics, and so I try not to let those factor um, affect my ability to provide care to my community. So as long as I'm able to see the patients, that's good enough for me.
Hmm.
Mhm.
Well, yeah, in every place, the grass is always greener on the other side of the fence.
Right.
Places you think there's politics on your side, but there's politics everywhere.
Right.
So yeah,
Mhm.
good luck getting away from that.
Right.
Yeah,
That- yeah. That's what I concluded.
right. There you go. So tell me about, I mean, how you've already touched on this a little bit, how your personal life philosophy and your background, maybe your Islamic faith, whatever, has led you or influenced you to be a part of the community of community health centers and work with underserved populations and the uninsured.
Yes. Oh, most definitely. So, as I mentioned earlier, I grew up in humble beginnings, and
Hmm.
uh, so that life has been a part of me. And um, because I became successful through education, I wanted to utilize that as an indication that I was given a gift to help my community. So that's how I looked at it, and that's where my passion
Right.
came from. Just seeing the um, just seeing the community, and the city. There were a lot of like depressing moments with poverty, the increased crime, just the living conditions, the neighborhoods that we lived in. I just felt that um, you know my gift would be best suited giving back to the community. That's really helped me to become who I am.
Right, right. Do you, so it, your mom sounds like, is she still living?
No, so my mother, she passed away. So that was another aspect that really it was really, of course it's hard, when you
Sure.
lose a parent,
Yeah.
but in the respect of, medical, she passed away from medical condition, cancer. And so it was really hard on me because I was a physician at the time that she passed. So I took a lot of it, onto
Mhm.
myself. How come I can prevent it? Just the normal 5 stage, of grief. Um, and just now it's been 4 years right now, so now I had time to like really like reflect and see. It was colon cancer, a preventable cancer, and
Yeah,
so that is the reason why
right.
I'm here.
There you go. So,
That's
but,
it.
but where I was going with that was, your mom sounds like she was quite the mentor and
Oh,
quite the,
absolutely.
yeah. How are you carrying that mantle forward, that your mom, that example your mom set for you?
I'm gonna answer um trying to understand what you're asking. So So my mother, she's an educator. She's very involved in the community. Her faith, she's really devoted Muslim. And because she really emphasized and really pressed upon like education, is the key for success, and education is the key to give it back to the community, and actually really honestly to improving the health of our family. Obviously she was aware of her family who um, passed prematurely, and so I'm the first um, doctor in the family. And I didn't mention this, but I have a younger brother. He's 2 years younger than I am, who is also a physician,
Okay.
internal medicine, hospitalist physician. So you can imagine my mother just being, really proud. And
Hmm.
so with that being said, um, I mean, the mantra. So that's it. So we are making sure that that we
There you go.
continue on what she instilled in us. So,
That,
and we're doing it currently. Um, I mean, during her last year, it was really tough for me because my brother, he's practicing now overseas, so I'm the family member who's a medical professional, and in the same city. So I was the caretaker, I was the decision maker, and that was really extremely tough, like
yes.
extremely. But she felt comfort in having me there, like just as an advocate.
Oh, absolutely.
Hmm.
Yeah.
So
Yeah.
so that so in the beginning, I blame myself, but just looking back, the fact that she like really looked up and like she felt that the thing that she's instilled in me, she was able to give back.
Nice. That's quite a legacy. That's pretty cool. So when you're talking to, so speaking of kind of mentoring and leading up, when you're talking to younger physicians, maybe residents or even medical students, what do you try to, what do you tell them about what it's like working in a community health center, what it's like working with the population that you have the privilege of working with in a community health center? And what kind of myths do you try to dispel? What messages do you try to get through to them?
Oh, definitely. Great question. So I definitely pretty frank and open, and inform them that either the community that we serve, um, the primary I guess diagnosis are social determinant of health,
Mhm.
that is really impacting their quote unquote medical care, medical diseases that we learned in medical school. So yes, they have the diabetes and hypertension, but we have to get through the layer of the social determinant in order, the challengingly, I would say that that's the hard part. And
Right.
so so you can really not necessarily weed out residents, but you want those who are passionate, understanding, and really in it to really save lives. And in order to save lives, it's not just you're not just doing textbook medicine. You're really um, trying to understand the social, economic, nutrition, even systemic. I would have to say systemic. Um, there's systemic disparities within healthcare,
Yeah.
and well, I don't, at least I don't think I was taught that as much in medical school or residency. It's just something that I'm born in this system, so I'm aware of it from experience. But there are others, with different cultural backgrounds who probably just see the media, but this is real life that the patients are living, and and that is, I would say, 70%, 80% of what affects the outcome of their health. And so that fact is something that every doctor needs to understand before they work anywhere, but particularly at a health center. I found a lot of provider physicians, including myself, I'm just getting on the verge of burnout.
Mm.
That mental strain, and that just being entrenched in the lives of the patients, and just feeling like you're not moving the needle. You're feeling helpless, um, because their living situation, their PTSD, their access to to um, nutrition,
Sure.
food. You can't really expect a patient's diabetes to improve if they can't, access their food. So you're just feeling it's emotionally draining. But I just would like to remind everyone that um, don't feel so self-defeated. You are making a difference in someone's lives. I mean, you may not see an A1C improvement right away, but there's something that you are doing, because what I've discovered working at the FQHC is that patients, um, they're very intuitive, very smart, and they're looking for that rapport. They're looking
Mhm.
they're looking for that commitment from the physician before they even decide to open up and engage with you. Once you develop that relationship, you'll notice drastically their health will improve. And so that approach is the approach I believe is necessary to address, pretty much all of our patients. You just have to meet them where they are, acknowledge them where they are, never, admonish a patient, never make them feel guilty, and just, just be committed and consistent, and reach, and the patient, they start to open up because they feel that you care. They can genuinely feel if a physician, and they'll tell you, they'll other patients, they tell me, their interaction with other physician and providers. And so that's how I know, like, they said this about them. Okay, so that's why they didn't take that medication.
Right, right.
So that's what I would tell a lot of the residents. They obviously would have to experience it for themselves, but just so that they're not blindsided, that it is tough. It's tough. It's not a walk in the park.
No, well, and I think it's tough. It's difficult being. It's not an easy path to take being a doctor. Period. And being a physician. Period. And yeah. So what's the? Tell me, is there such a thing as a typical day in the life of Dr. Aqiyla Muhammad?
Yeah. So as you know, I'm a chief medical officer right now, and I've been in that role for a year, and in the midst of the pandemic. So my life in the past year is completely different than it was before. So currently, because of the pandemic, I have young children who are exclusively virtual, and so I spend a lot of my time on Zoom and Teams meeting,
Mhm.
um, doing virtual, and I go into the office at the very least once a week to see patient um, in the office. I do primarily I have primarily administrative meeting time, which
Mhm.
you can imagine, and telehealth. And so my patient care schedule is pretty consistent throughout. I have telehealth patient care on Monday afternoons, all day Wednesday, and I have in office Thursday afternoon. So that's consistent for me. The other days, I'm in meetings with various members of the Spectrum team as the CMO, just ensuring that our program is up and running. And so today, Tuesday, it's my administrative day. So I've had um, COVID debriefing meetings. Um, I have in a few a one-on-one meeting with the CEO, Veronica. I have meetings that I conduct with my direct reports,
Mhm.
um, and just meeting, and on right now lately is a lot of focus has been on COVID vaccination, COVID testing. But as you can imagine, we still have other disease processes that we have to manage, and different programs, different quality measures. Um, different things that HRSA requires us. So the meeting, of course, the topic of the meeting would change, but the day in the life, is pretty much meeting or patient care.
Right, right. Gotcha. Well, thanks. It's a great background to have that kind of administrative description of administrative job like the CMO too, and keeping your fingers also in direct patient care. So, Is there anything else you'd like to add? Something we missed for that you were hoping to say today?
No, I mean, you
Okay.
got a lot. I
Yeah,
would say.
we covered a lot. So, well, Dr. Muhammad, thank you so much for taking this time with us, and thank you for all you're doing there in West Philly for the folks at Spectrum. Thank
All right,
you.
no problem. Thank you. Thank you for having me.
You're welcome. You're welcome. Just stop.